is not only a tough thing for your body, it can also affect your mind. Psychiatrists will join us to explain. Not only is the heat that we're experiencing tough on your body, it can also affect your mental health. Joining us now, psychiatrist Dr. Sid Khurana. And Dr. Khurana, thank you so much for joining us.
Thank you for having me.
Yeah, this is a time of year where we do brace ourselves for the heat and we think about the effects of like heat stroke and heat exhaustion. But now we're learning that a mental health condition can also get worse. Let's talk about how the heat affects our mental health.
Yeah, heat has a huge impact on our mental health. We call it's the triple threat. One, people with psychiatric conditions are at a high risk of being affected by heat-related conditions. The medications we prescribe or our patients take, they increase the risk of heat-related sequel. And then the third thing is the adaptive changes that people with psychiatric conditions have to adapt to this hot climate. That's why we call it the triple threat.
Yeah, and if you're one of those folks who does in fact have one of those prescriptions, what should you be doing?
Well, if you take anything that is considered to be a psychotropic medications, which is to manage your mood, anxiety, or antipsychotics or mood stabilizers, first and foremost is make sure that your prescribers, the psychiatrists who are managing it, are aware of the exact dosages you are taking and how often you are taking, and any other medications you're taking, because medications interact with each other and can affect their levels go up and down. What we say 101 to everybody, drink. Drink enough water, stay hydrated, stay indoors to the extent you can, because these medication levels can change when the heat levels go very high because of the water loss.
Yeah, when do you know you're in trouble, doctor?
Well, the goal is to know before you are in trouble, because when you are in trouble, it might be too late to know you're in trouble. So the idea is take your medications as prescribed, take your water content, keep it constant. Don't change the levels up and down. Don't go take the medication for 4 days and don't take it for 4 days. That up and down of levels is not very good for you. And the medications can affect our body in so many different ways. Our medications can change the internal thermostat of the brain. So our body doesn't recognize when it's too hot. A part of you knows it's hot, but the brain doesn't register it. The hypothalamus is the part of the brain that it doesn't recognize it's getting too hot. The medications can also interfere and not let us sweat as much, which is one way of how we deal with the heat. And that's how the medications can affect how we deal with the heat. And the best way is to stay consistent on your dosing. Let your doctors check the levels of those medications to make sure they are not getting unusually high. And if they are getting unusually high, then we need to do something about it. To your question, what do we do? If your vitals, which is your heart rate, blood pressure, are starting to get affected, if you, most importantly, are starting to not make sense of things, so if you're starting to be confused or you're not recognizing people that you know, that's when we say that you might be getting a little delirious, and that is definitely the time that even before that, your doctor should know about that.
Okay, what if you're not on any of those medications and perhaps you haven't been diagnosed with anything? Could the heat also affect others who may be perfectly fine until you have these record-breaking temperatures that we're seeing?
Yeah, we in general know that whether somebody has a psychiatric condition like depression or anxiety or not, heat affects everybody. In general, emergency utilization of psychiatric services, more people go to the emergency room as temperatures rise. All psychiatric conditions go up, the prevalence of that as temperatures rise. And we all tend to be more anxious, more irritable, more short-tempered as temperatures rise. So metaphorically, when the external temperatures rise, the internal temperatures rise. And generally in winters, people tend to be more they want to sleep more and they're more calm and they want to eat more, whereas when the heat goes up, they're more on the edge of their seats.
Yeah, makes a lot of sense, and hopefully folks are taking heed to everything you just said. Thank you so much for joining us.
You're welcome. Thank you for having me.
Happy to have you.